Hello, I'm Anna Osland. I'm the Director of Research at the Blanco Public Policy Center at UL. We're excited to welcome you to our Lunch and Learn for Whole Health Louisiana. WHL is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Initiative, and the Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, it is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. Whole Health Louisiana has four priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, Whole Health Louisiana's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. All right, I'm going to turn it over to Quinn, who will be the moderator for today's session and introduce our speaker. Thanks, all.
Thank you, Anna. Hi, everyone. I'm Quinn. So let's go ahead and get started. I'm a research associate here at the Blanco Center and coordinator for the Whole Health Louisiana project. I will be moderating today's webinar and all of our future webinars along with my colleagues here at the Blanco Center. As part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Louisiana plan and features presentations from industry professionals and subject matter experts. Our planned webinars are listed on the Eventbrite page that you all use to register for today's event. And before I introduce our speaker for today, I first want to mention that our ASL interpreter today should be pinned on your Zoom page throughout today's presentation. Her name is Lissa Gill, and again, you should see them pinned. If not, please let us know and we can troubleshoot. In addition, if you are attending to receive CEU credits, please remember to complete the post survey to receive your credits. And for today's webinar, we are only offering nursing and social work credits. Okay, with all of that out of the way, I'm going to go ahead and introduce our speaker for today. So our speaker is Daniel or Danny Adams, who is a retired assistant fire chief from the Baton Rouge Fire Department and a former first responder lead for the Office of Behavioral Health and the Louisiana Spirit Crisis Counseling Program from FEMA and SAMHSA. Adams is an accomplished trainer and he specializes in training for critical incident response, suicide prevention, and peer support. His passion is connecting first responders with the services they may need, and he brings more than 40 years of experience to help first responders throughout the US and Canada, and especially here in Louisiana. His expert knowledge in distress response, triggers, PTSD, and resilience of reactions to the job of a first responder helps to connect to the appropriate people to assist aftercare. He frequently serves as a consultant in his field, answering questions and connecting resources. Adams also helps families who are directly or indirectly affected by trauma or disaster by providing services that are informed by his involvement in all Louisiana disasters, from Hurricane Katrina to disasters around the U.S., and he understands the needs of people affected by these traumatic events. And with that, I'm going to go ahead and hand it over to our speaker to begin his presentation. Thank you.
Okay, let me share my screen and get started. All right, we already had that. All right, thank you for inviting me in on this this Zoom webinar. And as you said, I've had over 40 years of experience helping first responders in tough situations. My job was to help them cope with the trauma that they're subject to in their everyday professional careers. So, in that, when I talk about first responders, you know, I come from the firefighter side, but I'm going to talk in more general first responders. These are nurses, especially emergency room nurses or critical care nurses, also police, sheriffs, military, paramedics, all those people that are frontline personnel, and in some cases, even during COVID, we found out nursing home folks were our new first responders. Because they had to care for our aging population, and they had to do that constant care. So let's look at kind of things that I've experienced through my career, and what I tell first responders to look at is think about the divorces first responders go through. And we're going to talk more about all these things, but I'm just going to just touch on the different things. Suicides, and how that affects not only the department but the family and the friends. Addictions, alcohol, illegal drugs, even some prescription drugs. Life expectancy after retirement. This is another factor. And then some of the behavioral health issues that first responders go through during their careers. And then considering their past experiences versus now. So the young firefighters that come on board, or even law enforcement, I've been blessed to help state police in their training academy, is watching these young people come and start carrying guns and have to be by themselves on calls. That being young and being excited about doing your job, but also the traumas that you're going to be witnessing. I always tell everybody, said, first responders, 5 years from now, you won't be the same person. And as we talk through this, I'll explain more in detail about why that's so. So divorce. So nationally, there's over 57% of us are married in the U.S., and there's a little over 9% of divorce in the U.S. So let's look at the fire service, and a lot of this is, you can almost take this and put it in the other first responders. Is 77% of the first responders are married, so it's a higher number of first responders that are married. But also look at the higher numbers of divorce. And then there's not only just one divorce, there may be 2 or 3 different divorces with the same person. So that's a commonality in first responders. So divorce factors, and this is stress factors also, is their schedules. Working either 12-hour or 24-hour shifts. In some cases, I see some departments, I'm getting notices, they're working 48 hours. So those are factors, not having a good family connection. Post-traumatic stress, seeing what everybody else doesn't see. When you hear it on the news, there was a wreck, there was somebody who passed away in a wreck. Those first responders have to see that. They have to touch those people that died as a result, or pulling people out of a fire or even a wreck. So physical, mental, and moral injury from witnessing those vicarious traumas. Stressors of trying to fit in, especially if you're new. You're trying to get the older guys to appreciate you and be a part of that organization. Overprotective. So I'm going to give you a quick thing over what overprotective practices are. So being a firefighter, I've been to a lot of fires, and I've seen why some of the fires happen. So I won't allow extension cords in my house. There's none in my house. If there's an extension cord, it has to be a protective outlet where it can flip off in case of some problems. Because I've seen more extension cords fires than anything in my career. So I'm overprotective with that. And then other first responders do the same thing. Financial, we're overburdened. a lot of first responders don't make a whole lot of money. You think they do, looking at their uniforms and stuff. So, oh, they must be in a high paying job. Not necessarily, but it's a job that they really love doing, and they wouldn't give it up for nothing. So what do? They work extra duty, and they work second jobs. So here again, we're away from our family. So it causes family strife sometimes. Divorce issues. So first responders don't work a normal schedule. So what does child custody look like? I was one of the first men in Louisiana to get joint custody in a divorce. And my lawyer couldn't even believe it. And she said, "You sound really sure of yourself." I said, "Well, it took two people to bring the child in, and it's going to take two people to raise the child." So I was able to come up with a schedule that was optimal for my shift, but also fair enough for both of us. So non-traditional work hours, and we have pension. So during divorce, your pension may be affected because once you retire, there's some monies that goes to your ex, so whoever that may be. Overtime, sometimes there's forced overtime, especially if we have an emergency. There's different work hours that are expected, and then those second jobs, the make up the monies are, or especially if the wife isn't working or the husband. So firefighters live an average of 10 to 15 years less than other industries in retirement. I've been blessed. I've been retired since 2008. I'm now 67. I'm not scared to say that. I made it. I've outlived my father, who was a first responder. So, and then especially in the fire department side, 14% higher risk of cancer. I'm also a cancer survivor due to the exposures that I've had in my career. And then 60% more are likely to leave the job due to the health conditions. This could be heart, lung, cancer, a lot of different things, or even mental health issues or exposure to PTSD. A lot of first responders are having to stay till they're 65 because their cities that they work in don't provide insurance when you retire. I was shocked. I was blessed in Baton Rouge. We have that. We have insurance, but in other cities they can't afford that. So that's an option that they don't have. So what's this do? This puts older people still in the first responder agencies that are not really healthy, and they probably need to retire, because of their age or their ability, but they can't afford to. And then we have other things in retirement is PTSD, past traumas, the heart, lungs, hearing, cancers. They're contributing factors. Also, I'm going to get into, let's see, here, loss of connection. So once you retire, there's a connection. It's like getting out of the military, getting out of the police department. When my dad retired from the police department, I said, "Man, you ought to be glad, Dad." And he said, "Nope." He said, "Son, that's the scariest thing you'll ever do." And he says, like any job and that you have, once you retire, you have that loss of connection, that loss of purpose, especially if you don't have outside hobbies or likes. Those things are really important. I was just telling some church members the other day, I said I was so thankful. I was connected to a church that does a lot of outreach and stuff like that. So I stay involved in my community. So that gives me a lot of purpose. Now you have a fixed income. So there's another adjustment that you have to have. So your paycheck's not coming twice a month. Now it's coming once a month. So now you have to budget for that for the whole month. And that's another stressor on first responders. I used to go to the fire stations and drink coffee with the the firefighters just to check up, and they like to hear the old stories and stuff and laugh. I can't do that anymore because now the fire stations have high fences. They have codes to get in. I don't know those anymore. And some of the phone numbers have been changed, so it's hard to get in, and unless you know somebody still there that you call them on their cell phone. So those things are things that are different now. And then a lot of times our first responders don't realize we have a lot of benefits past retirement. So that's one of the things I try to educate first responders on, and we'll talk a little bit more about that in a minute. Yeah. So let's talk about suicide. So the reason I started doing peer support was because of the suicides we had in our department. I was doing critical incident stress management. I was a team lead, and I was going to all these suicides. And the thing that I saw, it was not just the suicide of the member that you're going to; it's the suicide of the family. That's what I kept on seeing. I said, I'm not here for that person. They're gone, but this family is suffering. So, and first responders, all that trauma that they see all their lives, it changes their worldview. The ideation and lifetime prevalence of suicide, 47% of people will think about suicide, but not necessarily act upon it. And then 19% of people in their careers will come up with a plan about suicide, but not act upon it. And then we have over 15% that have attempted suicide. That means they acted upon it. And that's a scary thought. So, compared to the U.S., we're a lot higher, a lot more exposure that we have. 1 in 5 first responders will develop PTSD, which is post-traumatic stress disorder. Now, I tell first responders, because when you put a disorder on it, that means that they feel like they got a disease or something. So I started using PTSI, which is post-traumatic stress injury, because the injury came from the exposure that you got exposed to. So that's how I describe PTSD, and it sounds a little bit better now. And we're trying to change the wording a little bit. Instead of having a disorder, is having an injury. So suicide in the fire service is pretty much the national demographics. So if you look at the suicide statistics nationwide, it looks about the same. The factors, the gender, age, ethnicity, factors are compassion fatigue and vicarious trauma that are carried on. Those traumas, they stack, trauma after trauma after trauma, and it may not affect you right away. And then something happens, a trigger happens, and all of a sudden a trauma will come up that you will actually see it like it's a real live video. And that's where it could come in. It could go to PTSD. So those are some factors that we've noticed over the years. Some other factors is the family, financial, prior suicide behavior, or prior suicide experience. That could mean not just yourself, but a family member or a close friend. Mental health in general, and then losses that mean that where those people were really close to you. And this could even be divorce. That's a loss. And then you have loss of having your kids all the time if you have children. That's a loss. So some of the signs of burnout, and I put burnout under suicide because this is where it could lead to suicide. Burnout is real. I can almost picture burnout in the fire service. When I joined the fire service, it was people that were cynical. They were stressed, irritable, didn't like anybody, didn't like nothing, didn't like what the department was doing. I said, man, why don't you just retire then or find you another job? But that was burnout. They loved what they were doing, but because the leadership didn't understand and didn't address it back in the days, they suffered that burnout. It was back when I joined the fire service. It was the saying was "suck it up, buttercup." So in that, it was saying, this isn't bad. You're gonna get this all the time, and it's not good to suck things up. It's good to talk about it now, and we're actually doing that better now. I've seen a change across the United States and Canada. Behavioral health, the age of the firefighter. I've had firefighters that had previous mental health issues, and they've called me for peer support. And there's still firefighters today. Some of the questions were, should I continue doing my clinical visits, or it's too expensive. It's getting, I'll save money if I stop going. I said, so what's the price? So I always give them the story. I said, one of the things I've heard that I think is something I do, me and my wife, is we go to mental health services once a year. And everybody said, oh, y'all, why you go once a year? And I said, well, it's like your car. Your car, you change the tires on it when it needs tires. You change the oil. You check the levels. You wash your car. You take care of it because you want it to last. Same way with your mental health and your marriage. Seeing a behavioral health person is not a problem. It's a good thing. It's like, and this is when we had it was a man's field, female and male now. But I tell everybody, look at mental health as like having a coach. Coach, brings you on a team, and they talk to you about, if you're playing baseball, how to hold the bat, how to swing the bat, how to stand. They're teaching you skill sets, how to be better. So that's what behavioral health, that's how I describe behavioral health. Life experiences, how you're raised, your job experiences, what kind of jobs you were in previously, if you had previous jobs, resilience. And this is one of the things we'll talk toward the end, is I believe in resilience. And as resilience just doesn't happen, you have to work on it. Hobbies, married, living at home with parents, or living alone by yourself, not having a lot of support, maybe. These are things that we need to recognize. And outside supports as church activities, family. I think hunting's good. People like to hunt, fish, ride bikes, boat ride, travel. All those things are positive things to do. So behavioral health program components, these have come a long way over the years. The employee assistance program in most departments are present, but not present. let me explain that to you. So there's the employee assistance program is there for a city to cover their tails in a way. We have a program for you. If you need help, just call them. So they call them and they don't get the right help, or the right person is not there to assist them, and it ends up failing, and then it gets out to the whole department and nobody wants to use it. So one of the advice I give departments is make it doable, make it workable, and make sure they're involved with your departments. I think this is critical. They need to know who they are, and they need to understand what kind of job they do. And we're going to talk about that more about that in a second. And member assistance programs. So these are things like rehabilitation centers, uh, the help of injury that you might have, having addiction facilities. The fire service, our International Association of Firefighters, has uh, a firefighter only addiction facility, and we've been running it for quite a while now, and there has a better success rate than any addiction facility in the United States. And the reason is you're in there with like people, and we're all going through the same thing and experience some of the same traumas and stuff. So I think that's important to have behavioral health specialists that are vetted. And when I say vetted, behavioral health people need to be invited into riding in a fire truck, or riding in an ambulance, or riding in a law enforcement car, and going on those calls and experiencing some of the things that they go through to help understand why they may come visit them, and the know how best to help them. One of the things I've asked behavioral health people: are you good with someone with a gun on side of them talking to you about PTSD? Because they may not be comfortable, and that's a conversation you have to have with that person. They can put their gun up when they're visiting you, and if you want them to do that, but you need to have that conversation and be open with it. Peer programs. I'm a big advocate on peer programs. I teach peer support all over the nation here in Louisiana, and we just did in St. Tammany Parish, just did a big program for them, and I'm so proud of them. They're really on top of it. So this is what's going to help reduce all these things that are the first responders are going through. Family services, how to be a father for the first time, or a mother for the first time, how to help your elderly parents, how to help your special needs children. There's all kind of different things that families go through, and having those services or like persons in your department that you can connect with. Retiree services. Believe it or not, a lot of retirees have a lot of programs. So we have a heart and lung bill, which pays for all your heart and lung issues that you may have for firefighters. We have a PTSD bill that was passed in Louisiana. It's now an act. The only people that aren't involved with it is the sheriff's department. They decline because they have their own program. But what that does is help all the first responders get the behavioral health when they're feeling like they may be experiencing PTSD. And then from there, it pays 100%. And once you get diagnosed. Let's see. And chaplains. I believe in chaplains. I believe chaplains bring a whole different level to peer support. There's somebody that you can talk to and tell them just about anything, and they're non-judgmental, and that's the way everybody should be, is non-judgmental. So we talked about vetted clinicians and therapists, also vetted inpatient treatment centers. So if you're a first responder and you need treatment, or you have something that you need to go to be checked in, the number one thing around here, I know in Baton Rouge area, we were having to bring them in the emergency room. Well, that's where first responders bring patients in, and they may be recognized if they go in there. So sometimes you need to vet that and have a connection with your hospitals and your programs that can we go in a different way, that peer support, help out there. Vetted psychiatrists and prescribers. I know Louisiana, when I worked for the Office of Behavioral Health, we have such a shortage of psychiatrists. and they're the ones that prescribe medicines and stuff. So that's a problem here in Louisiana, I believe. But and then list of 12-step meetings and support groups. No AAs online, so you can get a lot of information online, and we teach peer support how to find that information. When somebody calls me, I said I can get online and find anything anywhere, and in the United States, wherever I'm at. Even when I go to disasters out of state, I look for the resources first before I even leave Louisiana. So I already have an idea of who I can talk to or who I can send people to. Addictions. So I'm not gonna lie and say we don't have addictions in first responders. We do, and I think that some of that is the numbing of all the things that we're exposed to. You got to understand that addictions is a bigger problem than suicide, believe it or not. We have over 130 opioids deaths a day. That's a lot. And it's scary. And we see that every day. And even though there's Narcan out there, we still have the deaths. Co-occurring disorders could have substance abuse and mental health issues at the same time. So this is something, that's been recognized. I know the state was doing a great job of making sure that was recognized. Inpatient programs, outpatient programs, mental health support for not just the individual, but for the family. One of the things we do, we have handouts for the families. How do you help your loved one through addictions? And that's important for the family to help understand because they're part of it. So this one I got from the state. This one's a couple of years old, but it still tells you some pretty good stuff here. Look, this is, if anybody in Louisiana, this is Tiger Stadium in Baton Rouge. So if you look at this, we can fill up that stadium with all the opioid deaths. And that's scary. It shouldn't be that way. And this is nationwide. Opioid deaths. That's one of the things that we started helping with the fire departments and police departments, getting Narcan to them. So one of the things that I learned in our department in Baton Rouge, the chief, he said, "Can I get Narcan?" And I said, "Yes, sir." And I helped him connect him to the local governing entity, the Behavioral Health Authority for the area. So I said, "How many they give you?" And he said, "Well, I got 4 boxes per truck." And I said, "Wow." And I said, "So we're going on that many opioid calls?" He says, "No." He said, "I got that many so I can take care of my people, my firefighters, in case they get exposed to fentanyl." And I said, "Wow, that's some good thinking." And that's scary that they have to do that, but they have to have it for themselves too. So Louisiana statistics with the opioid deaths, over 2,600 deaths a year. That doesn't seem like it's going down any, but it's still a lot. It's just way too many. If you're a first responder, you're gonna respond to opioid death sooner or later. All of them do. My daughter was an addict at one time. The fire department responded to her, and she was dead. Well, they brought her back with Narcan. They intubated her and got her to the emergency room. She's alive today. She's clean and clear of any opioids and doing well for herself. But we first responders, we experience that with our own families too. So we're not immune. to this drug poisoning of our citizens. And then here there's a QR code where you can get the Naloxone, the Naloxone free, or where to get it at. Your local LGE has access to that. They have federal funding, which helps buy that and gets it out to the community. I want to talk about this because I give this to first responders all the time. Is 988. I used to give out the suicide hotline all the time, and I knew it by heart, and I could quote it really fast. I didn't have to go on my phone and look for it. I knew what it was. And they said, why you know it so much? I said, I give it out. I give it out because I think that's a safety net. It said, if you don't give any resources but one, this would be the resource I'd like you to give to somebody. So now it's not only a suicide hotline, it's a crisis lifeline too. So no matter if it's suicide or crisis, you can call that number and you can get assistance. So how do you manage all this, or how do you get by with all the trauma and stuff that you're exposed to? And I told you, I believe in resiliency, and resiliency has to be worked every day. You have to work on resiliency. You got to do some things that help build that. So knowing what to do for yourself, what makes you happy? Where's your happy place? What do you like doing? What makes you feel good? What makes you get up in the morning? Things like that. You have to always question yourself. Get out there and move, walk. Yesterday I walked. I said hello to a neighbor. My neighbor said, "Oh, I was about to go for a walk," and I said, "Me too." I said, "Let's go walk together." So we walked together, and we had a great conversation. And he said, "Oh, you're the best neighbor." And I said, a lot older gentleman than I am. So, but we had a good time. So doing things like that are self-promoting. One of the things I tell firefighters, I said, "Look, you're away from your family for long periods of time. Make a date night with your significant other." I think that's really important. My wife, even in COVID, she said, "You're still responsible for date night on Friday night." So this is a hard one. But guess what? We did it. We popped popcorn, put a movie in, and just sat there and watched the movie together. And she said, "That's all I needed." Or I would cook something. And I said, "Come on, I'm cooking a meal today." So I would cook a meal. I love cooking, so that's not a problem. But things like that are enjoyable, and they help build that resiliency for when you need it, when stressors come up. Some people say, "Well, how can you handle hearing all this?" Because I'm pretty resilient. I know what I need to do to take care of myself. I know when to say no, and that's a big thing too. So there's emotional resiliency, the capacity to handle the emotional toll, but also mental resiliency, the skills that help you, with those rapid decisions and stuff that you may need to make. And so the way you blend these together is you practice these every day, and you just need to make sure that you're putting it on like your protective gear. You build that resiliency. You're laughing. I always like to find funny things. When I was a firefighter, we'd come back in the truck, and in the truck, we turn around. If it was a bad thing, I look at everybody and said, "Man, how's everybody doing?" I'd ask everybody. And then after that, I said, "Well, if you need to talk or anything, I'm always here for you." So checking on each other, the buddy system, looking out for each other, that is very, very important. So what works to keep healthy? Well, mental health checkups. That is I'm a big promoter of mental health and physical health. Go to your therapist once a year at least, or more, whatever you need. Uh, Also, go to your doctor once a year. Get a physical done. I just had my physical done. Uh, those are important things for uh, your expectancy of life. Uh, if you're on busy in a busy area at work, sometimes you can't get away from that. But if you can, ask for a different shift, or hey, I need a break. Can I go work somewhere else? That's not bad to ask for. Peer teams, rely on your peer teams. Here's your peer for your department. Uh, Connect with them and ask them for some resources or some information. Also, I believe in consistent trainings, like we're doing this Zoom here. These are things that need to be done in each department. Emergency rooms, all first responders, nursing homes. We did stress management for nursing homes on Zoom, and then we went in person later on, and they needed it. They needed it. They deserve to have that. So using those stress management techniques, not only to help other people, but to help yourself. Deep breathing is a big thing. I tell people that you can do deep breathing for 4 or 5 times. I mean, some deep belly breathing. And you take your blood pressure before and take it after, you'll notice your heart rate, your blood pressure goes down. You can do the same thing with your pulse. Your pulse is going down. So when I go to the cardiologist, believe it or not, I'm in the waiting room doing my deep breathing because I don't want to get in trouble. So it really does work. EAPs. If you have one, utilize it. Make it work for you. If you don't like what you're getting, say something. They're paying a lot of money for these people. Make sure your employer understands that, hey, I really want to use it, but it's not working for me. What's my other options? We have a pool of mental health people all over the state that have been vetted for first responders, and they're really good, and they're really happy to help. They're not only vetted, but a lot of them are connected to the first responders. And then helping first responders understand HIPAA and the PHI compliance. That way they understand it, what they can do and what they can't do. We can help each other, but some things I can't ask about. I can't be their spokesman for. Even though some first responders ask me, I need you to tell them what you know about me. And the first thing the clinician would tell you was, I can't use anything you tell me. I said, that's fine, but I'm going to tell you about him anyway. And he's the person may be sitting right next to me, and then I'm gonna leave. So it opens the door for them to communicate better. So one of the things that we've done in the fire service, and I'm very proud of this because I've been part of these programs for a long time, is the IFF Peer Support Program. We have a 2-day training that helps train first responders how to be peers. And then we have resiliency training, which helps them. It's a 1-day training that helps people understand how to build that resiliency in your department. And then we have a prerequisite behavioral health online. It tells you a little bit about what behavioral health is, the different aspects of it. Because at one time when I joined the OBH, it was OMH at one time, Office of Mental Health, and they changed it to behavioral health. So I asked the doctor that brought me to the office after Katrina. I said, why are we changing this? And he said, because we have addictive services on one side and we have mental health services on the other side of the office. We're bringing them together and making it behavioral health. And I said, it's an umbrella term. I said, okay, that makes sense. So they all work together. Also, we have our IFF disaster response team that goes out after disasters and help departments that are suffering a lot of loss and understanding. So I went on a lot of these. One reason was I worked the FEMA SAMHSA programs for the state, and I helped a lot of first responders here in Louisiana understand the process. And I'm able to do that nationwide also. So that was a little tool in my tool belt that I was able to use when I went out in the field. We have a safety planning for suicide, how to help people that are having thoughts of suicide, how to keep them safe. There's some great tools out there that you can utilize. We have a clinician training for first responders. Helps you understand the requirements. Also, we used to bring them in and put them in gear, firefighter gear, put the helmet on, put the air pack on, and then we'd bring them into a burning building, the controlled burning building, and help them understand what we're exposed to. And all of them come out of there, even mayors and council people come out and they said, wow, had no clue what y'all were doing. So it's scary for a lot of people, but we do it in a safe manner. So some of the trainings available for first responders, these are done nationwide. I do most of these. Is CISM, critical incident stress management. It's different. That's probably the most used here in Louisiana. And then we have the 2-day peer support training that IFF developed. I was actually one of the team that helped develop this right off the bat. We have psychological first aid, which can be done free through your local LGEs, and then mental health first aid. I love this mental health first aid. I even connected my church to this because we have a lot of people suffering from mental health that they don't understand how to help. So this is a good tool to have to help others. Suicide trainings. So I'm actually an assist trainer. It's a 2-day suicide intervention skills training. And then we have a Safe Talk, which is a 3.5-hour suicide identification and connection training. So what's good about the Safe Talk is after our 5th suicide in the fire department, I brought it to our department, and it actually saved a lot of firefighters just having that training. Every person was trained in it. So best practices is having labor and management working together, peer-driven programs with behavioral health oversight, vetted clinicians, funding. So one of the things I always ask fire chiefs, what's the price of a life? Because if you're not helping your firefighters do trauma, there may be a loss of life sooner or later. And the return value on your health and human resources, it's a value return on your investment. A couple of departments had their HR departments pay for the peer course. And I said, why'd y'all pay for it? And I said, we're investing in our employees. So that's one way to look at it. And then officer training, awareness and behavioral health and peers and resources, financial freedom classes. Those are done by a lot of churches. The Dave Ramsey classes, those are good. I did those classes, became debt free. It work. If you let it work, it'll work. So some of the last thoughts is there's a lot of barriers out there. Cost. People don't want to get involved. Don't want to hear somebody else's trauma. That's okay. let somebody else do it, but support those people. Sick time and disciplinary issues versus peer support. If you have peer support, those things are reduced. And then we have so many laws that protect first responders now that like I'm so proud of that. We really have done a great job to protect our first responders. And then funding is always an issue for any training. Uh, St. Tammany actually funded all the trainings, and it was a pretty good cost, but they did it, and they have a great team out there. Trauma is always going to be there. It's always going to happen. So we have to be proactive instead of reactive. If we can protect our folks, let them understand what they might be going through, that's good. That's what we want to do. We want to be proactive. Any questions? I know we're getting close to one. Thank y'all for letting me come on here.
Okay, we're gonna go ahead and start fielding some questions. Let's see, I already see that there's some questions in there. So we have a question for you from Edward. What are the biggest barriers you've seen when departments try to move from we care about mental health to actually using peer support and behavioral health services?
Oh, that's a great question. So when you start using peer support, so you're helping first responders in a liked position that do a liked job, the same job, and they can reflect and they can understand what you're going through. It's like a firefighter helping a police officer. A firefighter has no idea what a police officer goes through because we don't carry guns. So when you have somebody with a like profession, there's a peer, it actually reduces need for behavioral health. You're actually normalizing what they're feeling. A lot of times, that's all we need is that's hey, I'd be going through that too if I experienced what you experienced. So, did that answer your question?
Does anyone else have any other questions? I see that the chat is going off about people putting their names in the chat. But I'm gonna give everyone a little bit more time to yeah, okay, there's another question. What is one common mistake leadership makes that unintentionally discourages firefighters from seeking help, even when resources technically exist?
Oh, wow. So I'll give you a program that works. I think that'd be the best example. Is in Senate, not Senate, is it? Oh no, Austin Fire Department has a behavioral health program that encourages you to go twice a year. They pay for it. It doesn't cost you anything. And actually they hire two psychologists that work for their department. So you can go to them anytime you want. There's no cost whatsoever. You have physical fitness instructor to help you if you've had an injury, helps you recover and do your rehabilitation. You even have a nurse that works for the department that they can help manage some of your medications and make sure that you're going to the doctor and doing all the things you want to do. That chief has found that having that cost in their department for those people have actually reduced sick time and disciplinary actions in their department. I think that's it's a great benefit. Once they see that, I always tell peer programs measure. That's how you measure your quality of service. You look at your disciplinary actions and your sick time in your department, and then after a year, look at it again, see if there's any changes. That's how you can help understand where you need to address your department with those whatever issues are popping up.
Mm-hmm. Okay, thank you. I saw that there's another question someone had put it in the chat. But this one asked, how can I refer to the firefighter specific addition facility? What is it called?
Okay, it's the Center of Excellence. That's what it's called. Uh, that one is for career firefighters only. There is another one, Fortitude is the other one, and it's in Chicago. Not Chicago, it's in Illinois. It's not actually Chicago, in Illinois, and it's a first responder, but it has all first responders in it. It's not just fire related. But the Center of Excellence is one that we have that's only for career firefighters, and we're finding it very successful. So they're actually helping write the books on addiction, how the success things. So it's a mental health and substance abuse uh, facility all in one. They have two different facilities. They have two different licenses, but they're all on the same grounds. And it's built like one of the things I like about it is built like a firehouse. So when you walk in, you feel like you're back at a firehouse. And do the same. You have the same thing, you have the same chairs, watching the same games, and playing cards or basketball outside, walking trails and stuff like that. So if you Google Center of Excellence, you'll see it. It's in Upper Marlboro, Maryland, and then they have another one in California. It should be opening this year, I think.
Okay, thank you. That's all good to know, and that's all great resources. Um, I think we have time for one additional question if anyone has anything else they would like to ask Danny. Also have an announcement that the CE form is updated. So for those who are applying to get CE credits at the end of this, the form has been updated. So make sure you check that when you are filling it out. Any last questions we have before we end today's webinar? I would first like to say thank you again to our speaker for your great presentation. It was really insightful, and I certainly have learned a lot about, first responders and firefighters. And I also would like to thank our ASL interpreter, Lisa Gill, again for her amazing interpretations throughout today's webinar. So, if anyone doesn't have any additional questions, we are going to go ahead and let you guys go early. So thank you everyone for attending today's presentation. And again, the CE survey should be ready to complete and has been updated. If you have any questions or concerns when you're filling out the CE form, just email us at the Blanco Center and let us know.
Thank you very much.
Thank you all.